Hello and welcome to another episode of Auspol Explained. Today we will be examining the government powers during a pandemic. Where do they come from? What is the limit? How do these restrictions keep coming day after day? This video is because of the COVID-19 outbreak, but it could be relevant if this ever happens again. First off, Federal Parliament currently is not passing any new laws, except for, well, stimulus packages. Federal Parliament stopped sitting on March 23rd, this is filmed in early April by the way, after passing a stimulus package. But since then, more restrictions on our social movement have been announced and then enforced. So if Federal Parliament isn't sitting and therefore not passing any laws, then how is this happening? Then why is our Prime Minister announcing new restrictions live on TV? For example, the restrictions around businesses and public gatherings have been changing rapidly over the past few weeks, and they are quite likely to keep changing as well. Public gatherings were initially limited to 500, meaning concerts were cancelled. Then there were limits to 100 for non-essential indoor gatherings, which put a bunch of weddings on uncertain ground. Then specifically, weddings got reduced all the way down to just 5 people, which made a huge rush of people get married in under 24 hours to beat the restrictions, including the one and only Bindi Irwin. And also me. I share a wedding anniversary with Bindi Irwin. I'm married now, that's neat, that's pretty neat, yay. Don't worry, I live streamed my wedding from my parents-in-law's backyard. Like a responsible person, I did not put a bunch of people into a limited space. Anyway, back to the video. These increasingly strict rules are a vital part of stemming the rate of community transmission and fighting the virus. Who knows when a vaccine is going to be ready? So, despite the fact that the Prime Minister is announcing all these restrictions, they are not the result of the Federal Parliament. This is possible because of two things: the Biosecurity Act and the states and territories. One of the big reasons for the ongoing restrictions that we're seeing is because of the Biosecurity Act of 2015. The Act allows the Governor-General to declare an emergency if the Health Minister believes a human disease is posing a severe and immediate threat or is causing harm to human health on a nationally significant scale. So if we're affected by, say, the plague or yellow fever or the return of smallpox for some reason, this act will be used again. But also, smallpox is a very good reason as to why, vaccines work. Vaccinate your kids. The Biosecurity Act states that any human biosecurity emergency declaration lasts for 3 months. But the Prime Minister, Scott Morrison, said that we are looking at least 6 months for dealing with the current situation. This means that a declaration can be extended for another 3 months, so long as there's evidence that there's still a threat. The Health Minister, which is currently Greg Hunt, can issue any direction to any person and determine any requirement necessary to prevent the spread of coronavirus in Australia or to other countries, or implement World Health Organization recommendations. Failing to comply with the direction can land you a $63,000 fine or 5 years in jail. Though if you're in jail, at least you won't have to get into a fist fight with someone down at Woolies over the last roll of toilet paper. Though also, please don't commit crimes just over toilet paper. It's not worth it. Also, to make sure we didn't just casually breeze past those powers in the Act, I did say that the Health Minister can issue any direction to any person and determine any requirement for stopping a deadly disease. This is understandably a very powerful piece of legislation. The Act also allows the creation of human health response zones, which we've seen as hotels are currently being used as quarantine zones. Some friends of mine returned from a month-long overseas holiday and are currently in a hotel room, unable to go anywhere until the government is satisfied that they're not infectious. Thankfully, we are allowed to bring them things, so my wife made them cookies and I brought them some books, which were then delivered by hotel staff. People with COVID-19 or any other disease deemed deadly under the Act can be ordered to provide their contact information and health details, body samples for diagnosis, have their behaviour restricted, undergo decontamination and/or medical treatment, and be isolated from the community for a specified period of time. If they refuse, they can be detained by police, and it can result in a criminal charge for disobeying. If that sounds like a big power, that's because it is. The Attorney General, currently Christian Porter, said himself that these laws are strange and foreign to many Australians and must be used only as a last resort. The Act, however, cannot give directions to the states if the states disagree with them. Which brings us to part 2. The states and territories have their own emergency powers. You've probably seen a live news conference of Scott Morrison discussing the latest updates and restrictions announced by the National Cabinet. The National Cabinet is not actually a law-making body. It's just a formal meeting of the Prime Minister, the state premiers, and the territory leaders coordinating together to come up with and then implement a consistent national response to COVID-19. They're not making laws by themselves, it's a meeting done by video conference to discuss what can be done via already existing emergency acts and legislation. It is a newly formed group meeting together just for coordinating Australia's response to COVID-19. This means that the states and territories are working together with the Prime Minister to come up with how to approach the response on a national scale. They are then using a combination of their own pre-existing emergency powers and their own state parliaments to pass new laws. So although there is an overall national response to the virus, we are actually seeing slight variations between each state and territory's individual response. For example, closing borders. Not all borders between states and territories were closed at the same time. We're also seeing states and territories introduce on-the-spot fines and increase police powers to deal with the growing crisis. Western Australia, for example, has made a law that means anyone who coughs in the face of a police officer, doctor, nurse, firefighter, etc., while they have COVID-19 or create the fear that they have COVID-19, can be charged with assault and face up to 10 years in jail. So the restrictions and punishments are a mixture of the Biosecurity Act, emergency acts, and amendments or introduction of new legislation. So nationwide, there are the same restrictions on things like casinos, weddings, funerals, movie theatres, places of worship, and barre. I hope I'm pronounced that correctly. I might need some help with that. I'm not quite sure what that is, to be honest. But BARRE for those who are looking for the specific definition, and spins facilities, all the same. However, penalties for breaking state of emergency and Public Health Act rules vary between state. For example, in New South Wales, the penalty can be up to $11,000 and 6 months in jail. Queensland passed laws mid-March that allows $13,000 in fines for individuals ignoring direct orders from Queensland health officials. Victoria can fine people nearly $20,000, South Australia $25,000, and Western Australia doesn't mess around with a fine of up to $50,000. Those are the maximum fines. You might just get fined more like $1,000 or $5,000 and or 6 months in jail instead, depending on which state you're in. I must remind you that because of the ongoing nature of the outbreak, this information can become out of date. As the time of the video, those are the numbers. So it's possible those fines can vary and the circumstances in which they're applied can also change. So there could be changes in jail time or restrictions or just so many things, to be honest. But the idea that, there are police powers and you can be fined for breaking health acts or emergency acts is a thing that you should be aware of. So please visit your respective state or territory website to learn more about what the specific restrictions are. And of course, please visit www.health.gov.au for the most up-to-date information about COVID-19. The links to all the state and territory websites will be in the description. Other powers include Queensland's Chief Health Officer and senior hospital staff can force individuals into isolation. The Chief Health Officer in Victoria can authorise police to enter a premises without a warrant and order it to be disinfected if it's believed to be a risk to public health. While it's in a state of emergency, the Director General of the New South Wales Health Department can direct a person to undergo a medical examination and associated tests if they're considered to be a risk to public health, or order someone to refrain from certain conduct, submit to supervision, or undergo specified treatment. Similarly, in Queensland, a judge can issue detention orders for those with immediate risk to public health. So you can be forced into quarantine either through federal legislation or state and territory legislation. If down the line only one state is still heavily affected by a pandemic, the individual health and emergency powers of that state can still be enforced. As you can see, the powers to tell people not to gather in large groups or even small groups already exists as a power within already established legislation. So even with federal parliament closed, it's still possible more and more restrictions could be put on our lives to stop the virus. Declarations of emergency can last for different lengths of time. The Biosecurity Act lasts up to 3 months, but in Victoria, a state of emergency was called for 4 weeks in March, though it's likely that it will continue for far longer, which anyone watching this video in the future can attest to. New South Wales also said that its heightened police tactics are currently lined up to last for 90 days. Even though there are estimated times in place, they can be extended, and as such, there's no given date currently as to how long police will have heightened powers and movement restricted. So again, please check your respective state or territory government website. There are lots of new rules and restrictions. They may be confusing, but they all center around a single theme: stopping the spread of the virus by limiting how much people physically interact with each other. The gist of it is, don't go outside unless you need to for things like work, food, exercise, or helping someone in need. Don't invite groups of people over to your house. Please, we actually do need to take social distancing and isolation seriously. Modelling published by the University of Sydney says that 8 out of 10 Australians need to stay home to effectively stop the spread of the coronavirus. Currently, there's no natural immunity, and there's no vaccine, and so you can see why the government is fighting really hard to combat this virus and stop us from turning into Italy or the US. If you do have to go out, please follow the guidelines found on health.gov.au and keep 1.5 meters apart from anyone if possible. And remember, these heightened powers only last as long as the state of emergency does. Once we beat the virus, the restrictions have to be lifted. Quick note, I mean that the restrictions on movement and the heightened police powers granted by the Emergency Act must disappear. However, there may be changes to ordinary police powers granted by legislation in this time, so it is unclear as to what the powers of the police will be once this crisis is over. This may come as a surprise to some of you, it may not come as a surprise to others, but yes, the government does legally have the ability to restrict your civil liberties in times of crisis. Sorry, I normally put more jokes in these videos, but I don't know how to joke about coronavirus. Also, if you really want to see how quickly this video gets dated, when I woke up this morning to film this video, worldwide confirmed cases of COVID-19 had just reached 1 million. So there you have it. As always, thank you so much for watching. There is a link to the Patreon in the description so you can support free education for everyone. There is also a link to a copy of the script full of citations so you can read more about what I have talked about in this video. And as always, I would love it if you shared this video so other people could learn too. Don't forget to comment down what you would like to learn about next, and thank you so much. See you soon.